good afternoon, everyone. Good morning for Canadian. I hope everything is all right on your side. I hope the lockdown is it's finishing for you all. I'm Guillaume Carlier, the head of content and innovation for MIPIM Propelled by MIPIM. Sorry. I'm really happy to be there with you today. It's the last week of the daily talks. You do remember that these talks have been there for already 2 months. 20 minutes talk for an expertise from an expert in the real estate, and 10 minutes Q&A session. When you take the control, you can ask any question. And today, I'm really happy to have Étienne Lemieux, the CEO of Spibio, to answer all of your questions. Etienne, can you hear me well? Yeah, looks good. No, I cannot hear you. Yeah.
Yes. Hi.
Great. Thank you very much for being with us today, Etienne.
Thank you.
It's maybe the Canadian weeks to finish. We had one of your other friend 2 days ago. Really happy. I know that today you're going to talk about something really special about Legionella, about all the trouble, the new risk after COVID for reopening buildings. I'm really happy to have the Q&A session with you after in 20 minutes. And before that, the mic is yours.
Thank you. So let's start the presentation. Okay, so you see the presentation?
Yeah, perfect.
So
20 minutes, thank you.
Okay, thank you. So the subject of today will be how building owner will be prepared to deal with the next health threat, Legionella outbreak associated to early reopening after COVID-19. My name is Étienne Lemieux, and I am the co-founder and the CEO of Spibio, a company that helps businesses to avoid legal and moral risk related to Legionella bacteria contamination. So what is Legionella exactly? Most commercial and industrial buildings are equipped with cooling tower. New York City, for example, have 6,200 of them installed on rooftop, and they are used to cool the air inside the building. What people don't know is that these installations are at risk of being contaminated with deadly bacteria called Legionella. Cooling system owner must follow diligent cleansing procedure and management plan in order to avoid spread of this dangerous waterborne bacteria. So when inhaled by people, Legionella bacteria attack the lungs and can lead to a serious type of pneumonia called Legionnaires Disease or Legionellosis, which are fatal in nearly 15% of the case. So because this is an underdiagnosed disease, the exact number of cases remain imprecise, but it is estimated that around 25,000 people are affected by every year in North America. Hotel, hospital, factory, commercial building, and other type of facility are targeted as place where Legionella could develop and spread. So if not taken seriously and not treated adequately, the contaminated system project Legionella fill droplet aerosol outside of the building within a 7-mile radius. So posing a risk not only for the facility user, but also to the general public. So building owner must provide water sample to authority in order to ensure that their water system are clean of bacteria and they can continue on with their activity without putting any life in danger. If you take a well-known building in New York, okay, we can see the magnitude of a contamination system that spread the bacteria in the air and how quickly a large part of the population can be affected by a Legionella outbreak. For example, a notorious building which, given to the size of its infrastructure, has many cooling towers on its behalf, will spread a large span of damage if an outbreak occurs. Once an outbreak occurs, it can take up to 14 days before hospitalization begin. So owner may not notice abnormality in his water system. And during these 2 weeks, 1,000 of people who happen to be in that area are being put in danger. So the similitude between Legionella and COVID-19 will remember you something. So indeed, COVID-19 is also diagnosed after several days or weeks after being contaminated, which means it can spread during a certain period of time, and its presence is being unknown by the people responsible for the maintenance. The only difference between those two diseases is that Legionnaires disease cannot be transmitted from one person to another, but both take several days before they are detected, and the late they are diagnosed, the more damage is done. So our company, SpyBio, was founded in 2016, and we invent a highly sensitive device capable of quickly detecting the presence of Legionella in water system. The product is named BioAlert. So our main goal was to help the owner to avoid contingency related to the bacteria and to simplify their task of managing it by offering them a real-time monitoring device. So BioAlert is a 100% automated and installed directly inline on building water system. In less than 3 hours, this device samples the water, analyze it, and instantly provide result to the owner. When the bacteria is detected, facility manager receive an alert. Manager receive an alert and can take the necessary measurement to remedy the situation. No need for blindly administer invalid amount of chemical inside the system, since we keep the owner up to date on their water quality on a daily basis. And as opposed to normal routine facility manager that send out sample without knowing if their presence of Legionella or not for a period of 2 weeks. So with our years of experience and my team of 18 employees from different areas of expertise, SpyBio has shown to its client that diligence monitoring and constant surveillance of their system is the only and the best cost-effective way to completely control Legionella proliferation. So we have a new problem now. With the unexpected arrival of COVID-19 everywhere around the world, most building company and owner has to interrupt their entire economic activity without knowing when they will restart them. So because these systems were not designed to be shut down for a long period of time, Legionella bacteria will be more likely to develop inside. So for example, if you visit your cottage once a year, you will not expect to have a problem with your electricity, but you will take the necessary precaution in order to restart your water faucet or before you take a glass of water or shower. The same procedure applies for water systems found in buildings that are shut down for an unknown period of time in order to avoid that the water being contaminated with different types of bacteria. Water systems are not made to be stopped and restarted without careful attention and procedure. Whether it's a cottage or in a 80-story building. So because of the pandemic, maintenance routine have been put on hold, which means that Legionella will mostly spread inside system if not taken seriously. Public authority are warning building owner that they need to plan a plan in place to safely relaunch the operation before reopening. Those recommendations are not made to be taken lightly. Recently, an outbreak occurred in Gibraltar, a British territory found in south of Spain. So only after a week of reopening building, following their closure due to COVID-19, 4 elementary schools have once again been closed because their water system was strongly contaminated with Legionella and posed a high risk to the population. All the water system in the building are at risk. We surely talk about cooling tower, but also decorative fountain, pool, shower, hot tub, refreshment stand, etc., etc. When wanting to quickly react to contamination, a building owner will blindly administer invalid amount of chemical in their water without knowing the actual quantity of Legionella that are found inside. So it's a common mistake that can cause the spread of the bacteria through the air and can lead to permanently damage the equipment. So trying to entirely eliminate it, and as a result, cost a large amount of money to replace the broken equipment. This never before seen situation will lead to a major consequence. The Legionnaires disease, similar to COVID-19, could surface when this facility will reopen. In fact, it is predicted by the health care system that there will be 30% more Legionnaires disease case in the future due to this early reopening. Owner not knowing how to react to the situation and relaunching their system too early will be the main source. Hospitalization associated with Legionnaires disease are similar to COVID-19. So what is mean that patient having to be put on ventilator and will require the same resource as the one used for COVID-19. In 2014 in Quebec, some 184 people were diagnosed with this disease in Quebec and were sent to the hospital for urgent care. Now imagine that happened during the current pandemic. Those similarity amongst both disease could may cause many complications in hospital and something that we need to avoid. People affected with Legionnaires disease are also more likely to be diagnosed with COVID-19 and vice versa, considering the fact that the immune system are deeply impacted when fighting one of those two diseases. We have a new solution for this new problem. So the equipment we have developed is fine-tuned over the year, was mainly addressed for cooling water systems, such as cooling towers. Indeed, BioAlert is a heavy device designed to be fixed to a wall and permanently connected to a water building system. But since the beginning of the pandemic, the need for facility manager to take Legionella seriously, we saw a situation as an opportunity to widen our expertise and use it to any type of water system, make it accessible to a lot more person and widen the purpose of use. So for months, for the last 3 months, our experts have been working days and nights to figure out the way to adapt ourselves to the situation and to offer building owner the help they need to reopen their businesses safely. What that being said, we have proudly adapted our product to in 2 different ways to quickly respond to building owner urgent need for accurate preparation. So first, we turn a product into a portable device. So our client can now move the equipment inside a large building to manage their multiple system like ice machine or shower in hotel or drinking water fountain inside facility. Also, client can now move the product from one location to the other using BioAlert as a rotary preventive unit. And last thing, we rent our equipment now, so to address the urgent need that has emerged. So everywhere before owner reopening their building. Second adaptation that we have done is to develop add-on on the equipment. So BioAlert can now collect and test water from several sources, making it a multiple intake device. As you can see on the image, this device is now equipped with bottle rack that can support sampling of water coming from different equipment sources in order to conduct testing faster and easier. With this addition to our current device, a client can process now up to 8 tests in a day, and everything is done automatically. So once the product is activated. So BioAlert does not require any skill in microbiology, or with 30-minute training, anybody can operate it. Especially important during that time of lockdown, because in the pandemic, it is important to minimize the number of trips required to perform Legionella testing and avoid the overcrowding in workplace. With BioAlert, we can reduce the required time, effort, and trip to do that. So Legionnaire outbreak will become more and more frequent following the pandemic, and the building owner must react and be ready in order to avoid the risk of becoming dangerous to the public. The only safe and efficient solution to this problem is monitoring the bacteria on a daily basis and being proactive toward it. SPI expertise help facility manager to get back on track rapidly, and as a result, secure them to service, to return to service of their water system and also their economic activity. With BioAlert multi-intake detection system and its capacity of moving from one location to another, this device will serve many more companies while reducing Legionella-related health risk for the population. So here, what you should do to prevent Legionella-related event after COVID-19. Well, we are all deeply affected by this unprecedented situation, and many people will have to adjust their routine in order to comply with the reality that we will set after this pandemic. Nonetheless, with COVID-19 being the main subject in the media recently, we must not overlook the risk associated with Legionella outbreak. Therefore, it's remained essential for manager and for those in charge of the water system to maintain diligent and constant monitoring of their water quality, especially with the warm season coming soon, where Legionella outbreak are at their peak. So neglecting the mandatory bacteria detection process for all facility owners could lead to serious consequence. So our company offer support on that. Other company also offer, and we suggest a lot that you use any kind of device to adapt yourself to the situation. With the imminent reopening of most businesses, if you take the right measure and procedure to control the unavoidable spread of Legionella, you will immediately contribute to a significant reduction of the associated risk and reduced presence of people in hospital. So BioAlert or not, regular testing is always the solution for building owner to control the presence of this bacteria. I also recommend that you frequently keep track of your water quality to administer the right amount of chemical once Legionella is detected. Lastly, documentation everywhere, every testing result you are provide to protect you from any legal complication once an outbreak will occur. So those organizations are the best health standard reference regarding Legionella compliance. Their website contains many documentation for tips and recommendation on how to deal with this bacteria, and will most definitely come in handy to company when wanting to relaunch safely their activity. SPI practice are all based on these standards, and BioAlert was designed to comply with these guidelines. So just with coronavirus, the only message we need to remind to ourselves is that more than ever, the world needs test, and test in order to identify, isolate, and treat contamination before they infect others. We are fortunate enough that Legionnaires disease has been in book for a longer period than COVID-19, and we have the ability to react quickly and to prevent the impact of a second wave of this bacteria. With the right measure and the right tool, we can relaunch our activity safely and regain a bit of normality among this unstable situation. So thanks a lot for your time. Here's the information about the company. If you want to contact us for any question, don't hesitate. And also the presentation will be available. So all the reference for the website for any tip to relaunch your building will be there. I don't want to substitute with the guideline of different associations. So that's why we just refer to them to facilitate your understanding of the solution to the problem. Thank you.
I don't know how to add, Etienne. Just thank you very much. That was just a great presentation, great preparation. Thank you for that. I mean, that was perfect. I was really happy to prepare this session with you and learned a lot about it, even if sometimes it's a bit freaking me out. But yeah, anyway, okay, I can say that you've been reacted super fast in a way to prepare that. I mean, COVID was there in US and France like 3 months ago. So yeah, firstly, thank you very much and congratulations. My first question, because I can see that for now the attendees did not prepare the first question, but again, feel free to ask anything to Etienne for the next minutes. Then I will start by my question. You've talked about Legionella and COVID, but is your solution adaptable to any other disease or any other health trouble?
Mm-hmm. That's a very good question. The answer is yes. So we have a lot of different bacteria or microorganisms, pathogen that can lead to disease. A lot will be seen in recreative water, like Pseudomonas or Cryptosporidium. I know that's, I get microbiology PhD, so that's why I know all those terms. But yeah, and all those bacteria and pathogen will also increase because, you know, water treatment is necessary to keep them out. So if you treat less or if your water system is not made to be stopped, you will see this raise in terms of contamination. So yeah, we have other recipes that we can add to the same product, and we can do multi-spectrum analysis of different type of risk. Sure, Legionella is the first target, is the one that will kill people in the next month. So that's why we need to hurry up. One of the add-on that we present already are in function in 2 of our clients, and they use a lot. So they make 2 hours of car to bring that sample to their facility because they have only one equipment and they need to bring water from different sources. So yeah, we will do that in the future for other bacteria. But we need client to test that. So if you have any need, regardless to Salmonella, Listerios, E. coli, Cryptosporidium, or Pseudomonas, feel free to contact us. We need some bench tests to do that.
Oh, sorry, my son. Okay, I mean, it leads me directly to another question, but you've talked about your customers. How many implementation have you already done? I mean, how many times you tested it, and how sure you are about this solution now?
Yeah, in our case, you know, we have made 4 new installations in the last month. So just give you the impression of how people come crazy because then some people are very aware about the risk. But the add-on that we have present, we have 2 of them installed right now, and we have an order for 6th one that will be had to the product that we have launched. And about the product that are portable, all the product are not portable. So that's is like you know, a need now, and that was not the case before because they want to move the product everywhere in the building. Just imagine a big hospital, you know, with that's huge. So they don't want to. It's more easy to bring the machine than to walk every day with a water sample. And if you have an hotel, you know, you can have 200, 300, 500 room. So it's more easy to bring the equipment to the shower than to bring the shower to the equipment.
Okay, that's a good point. And if we go to the private places, I mean, taking into consideration how many people I know in France who have been out of their flat or of their house for the past 3 months, should they care about it? Should they take care and do some tests or think about it, even for a private place?
Yeah, so depending if the water system was still in use regularly, because the water from the town that are provided to your house or to your building have chlorine inside. But if this water is stagnant, okay, that's where the problem will develop. So if you still have activity in your house, this water will go through the pipe with chlorine inside, your risk is low. But if you have shut down a building or you have not been there for a few weeks or months and you don't have any procedure of cleaning and purge in place, I will suggest you to do a test. A lab test will cost you in France about 120 euro. In USA, it's $150. The cost is not high enough to contract a deadly disease. So it's always cost, risk, and it's always about the use of your system. Don't forget that those systems are not designed to shut down. It's like a wheel, not a wheel, a well. So if you have an abandoned well somewhere, you will not drink water from that. So it's same thing. They are not designed to stop.
Great, thank you very much. Again, you've been super fast in order to react and prepare this new offer. You've been marketing really well. How can you imagine this new offer in the future? I mean, it's for now. I hope you won't have to work so long for the trouble with COVID. I know it's gonna take some time anyway, but how can you imagine this marketing solution or this product for the next year and a half, maybe 2 years?
Yeah, those products will be there as long as the need for them will be there. So depend of how many shutdown because we anticipate some next wave. So maybe we will see other shutdowns. So the need will be there. And one thing is sure is Legionella is I just have the French word inside my head. So it's a opportunistic pathogen. So when Legionella become seeded or when he home your system, it will be there for a long period of time. It's very difficult to remove that bacteria from your piping. So same if COVID-19 is not there, same if no more lockdown or on the field, nonetheless, the bacteria can be present and can present a risk. So monitoring will be in the 5 or maybe 10 next year more needed because we hack poorly in terms of shutdown and take care of water system.
Great. I think that's much more that we can imagine to learn today. Thank you very much, Etienne. That was really great having you for this session. Again, for everyone, you can have all the information on the slide, and I'm sure Etienne will be happy to answer all any emails, any questions. Thank you very much, Etienne. And tomorrow is the last daily talks with Faber Novel about how to manage with distance, with the new way to manage your teams, and we'll be happy to share also this last session with all of you. Thank you very much, Etienne, and see you.
Thank you.
And thank you very much for all who attended today. That was a great pleasure.
Thank you to everyone.